Hello guys, good morning. Welcome back to my channel. My name is Ayel Simi and it's a pleasure to have you all here today. For first time subscribers, I appreciate you stopping by. It's a big pleasure for me to have you on this channel. Please don't take your presence with you. Just leave your presence behind by clicking on the subscribe button. Subscribe to the channel, like this channel, share the content and comment. Please interact with the channel. And for returning subscribers, I do not take you guys for granted and I love you all. Please remember to subscribe, like, comment on the content and then share with your friends, share with people you know might benefit from this content. So this morning we continue on the pregnancy series. I've had two series before now talking about, the first one was talking about the products you should avoid. The second one was talking about the food, safe food that you can eat, how you can eat food safely during pregnancy. Now, this particular one, I'm going to talk about the vitamins and supplements and the nutrition that are very, very important in pregnancy. Hello guys, welcome back. So, eating well in pregnancy cannot be overemphasized. I cannot say too much. I cannot say it too much. That good food and nutrition is very, very important in pregnancy. It helps you, it helps your body to be nourished enough to carry a baby. It helps your baby to get enough nourishment to grow and develop in a healthy way. And it helps both of you to go through the rigors of childbirth and helps you to bounce back quickly from childbirth, because childbirth is rigorous regardless of the channel through which you want to have the child. Now, when you eat good, nutritious food, it helps you to be healthy, helps your baby to be healthy, and after you have the baby, it helps both of you to be healthy. So I can't say too much that you should eat good and nutritious diet. People will target balanced diet, healthy and nutritious diet. Anyhow you want to say it, any way you understand it, it is important for you to eat a good and nutritious diet. Now, you see, most of these vitamins and supplements that we are talking about, you will get them in good, when you eat a balanced meal, when you eat a healthy diet, you will get most of this nutrition and the vitamins and supplements, you will get them in your diet. But most times, most often than not, you need to supplement your diet because you cannot eat enough for all the requirements, the extra requirements that your body requires during pregnancy. And that is why I have come with this series, so that you can know the things you should emphasize, the things you should pay attention to just before getting pregnant, and even when you just find out that you are pregnant. Now, one of these things is folic acid. Folic acid is important. Before you, in fact, if you are planning to get pregnant, start to supplement on folic acid. Folic acid supplement helps to prevent some deformities in babies while they are just growing in the first trimester. So it is recommended that at least you take 400 micrograms of folic acid per day if there's a chance that you might get pregnant, or if you just find out that you're pregnant, so that your first trimester, your baby does not develop that deformity or abnormality. So it is also recommended that you take daily vitamin D supplement. This will also help you and your baby to grow properly. Now, folic acid before and during pregnancy, like I said earlier, is important. 400 micrograms of folic acid per day is important for you to take when you are pregnant, at least until you are 12 weeks pregnant. between first and 12 weeks of pregnancy, 400 micrograms of folic acid per day is important for you. Now, what does folic acid, what does it help to prevent? There's a birth defect called spina bifida. This spina bifida is what folic acid can help you to prevent in your baby. So as small as that tablet of folic acid is, it is mighty. It is small but mighty. 400 micrograms. That is the requirement, daily requirement for a pregnant woman. And you take it until you are 12 weeks pregnant. And we know that there are natural forms of folic acid in your green leafy vegetables. Most of them contain high, your cereals most of the time, your margarine, they contain high folic acid. So you can also supplement on this, but it is recommended that you take a supplement. Now, for people whose maybe the baby's father has a history, a positive history of neural tube defect, or some, maybe you, the mother, maybe you are diabetic, maybe the mother is taking anti-epileptic medication or antiretroviral medication for HIV. If the mother or if the parents are taking this, then they will give you a higher dose of folic acid. They'll probably give you like 5 milligrams of folic acid. If there is that chance or risk for you or the baby or the baby's father, you will get a higher dose of folic acid. But then the GPs will determine that. They would, once you go for your test and everything, they know your history, they know your symptoms and all that, they know your diagnosis. So if this is the case, then they'll give you a higher dose of folic acid. Now, vitamin D is in pregnancy. At least you need 10 micrograms of vitamin D each day in pregnancy, especially between the months where we don't have a lot of sun. If you are allergic, that you are always covering yourself, even when there is sun, you are always covered up. If you're, if you're pregnant, your first trimester especially, or your pregnancy is during winter period where the sun is limited, the sun exposure is limited, then you must supplement on vitamin D every day. And about 10 micrograms of vitamin D is what you need. So, and some food also has vitamin D, natural vitamin D. That's your salmon, mackerel, herring, and sardines. They have vitamin D. Eggs have vitamin D. Red meat, they have vitamin D. So, and even some cereals, they have vitamin D. So they say 4,000 IU or 100 micrograms of vitamin D a day. It's fine. If you take more than that, it could be harmful. So check your supplement that you don't have more than 4,000 international units or 100 micrograms of vitamin D. Don't take more than that in a day. Now, iron in pregnancy is very, very important, as lack of it can cause anemia. You don't want to have anemia of any sort in pregnancy, because you see, your blood is what is feeding your baby. There's no food, there's no manna for the baby. It is what you, the mother, have in your blood that the baby is eating. If you not want to have a healthy baby, make sure you don't have any form of anemia. If you're not eating well, maybe you're always vomiting and all that, it's fine. But your GP must know this so that they can prescribe iron supplement for you. Yes, you can say one of the side effects of iron supplement in pregnancy is constipation. It can aggravate constipation. There's no way a pregnant woman will not be constipated. That one is a given. But iron supplement can even make it worse. But you will not continue to take fluids, take things that will help, take cereal, roughage, and all that will help you to go easier. But iron supplement is important if you are prone to anemia, and even your GPs will know. Always go to your GP when you're pregnant, and when they check your blood and all that, they do your blood work, they will know if you are prone to anemia. So you need to supplement on iron. Meanwhile, your dried fruit, your nuts, your green leafy vegetables, your lean meat, they all contain iron. Peanuts, they contain iron. Peanut butter, they contain iron. So your cereals, most of these cereals, granola, cornflakes, some of them, they contain iron. They're actually, you know, yeah, iron is iron. They have iron added to them, so they are good for you. Now, vitamin C in pregnancy. Vitamin C protects your cells and keeps your cells healthy. Even in when you're not pregnant, vitamin C is important for you. And that's why they always tell you have 5 portions of fruits per day. Now we are going to carry it over to pregnancy. You must have a minimum of 5 portions of fruit when you are pregnant, because vitamin C protects your cells. And that's not the only thing. You see, when you are eating fruit, the the pulp of the fruit, that it gives your stool bulk, helps you to go easily, helps the function of your lower intestines, helps your rectum to empty properly. So these things are important in pregnancy, even when you are not pregnant. They are important. Now, when you are saying the good sources of vitamin C, we are talking about orange and orange juice. We are talking about red and green peppers. We're talking about strawberries, black currants, broccoli, Brussels sprouts, and potatoes. These are very good sources of vitamin C. Now, calcium is very important in pregnancy. It helps your baby's bone and teeth to grow well. It helps them to form properly and to develop properly. Now, what are the sources of calcium? Milk, cheese, and yogurt. You have to be careful about yogurt though in pregnancy. Green leafy vegetables, tofu, soya, drinks with added calcium, bread and any food made with fortified flour, and fish where you eat the bones. Fish that help you to eat the bone, they are rich in calcium. Sardines will help. You can eat the bones of sardine. You can even eat for mackerel. You can eat the bones. So these are good sources of calcium in pregnancy. So in conclusion, I've said that the most important thing the most important thing of part of your vitamins, the most important part of your supplements in pregnancy, they are the ones you get from the food you eat. That means you watch the food you eat, you balance them properly, you bring them together, and you eat. Knowing that you are eating good and balanced and healthy diet. Now, you need to now supplement on calcium, you need to supplement on vitamin C, you need to supplement on iron, and you need to supplement on folic acid and vitamin D. So I have mentioned 5 things that are important for you, and I've mentioned the sources of these vitamins. I've mentioned their sources, and I have mentioned the safe quantity for you to consume when you are pregnant. So once again, guys, I continue on the pregnancy series in my next video. Thank you for those of you who are new subscribers. Thank you for coming. Please remember to subscribe before you leave. Remember to like, remember to comment, and let us talk about what you think about all these things I'm talking about. Or if there's anything you want me to do a video on, or if there's any question you have, you can ask me in the comment section. In the meantime, if you're an old subscriber, thank you for coming. I'm not taking you for granted. Please share the news with everybody. Let all pregnant women come and benefit from this channel. Once again, it's Ayosimi. I appreciate you all, and I'll see you in the next video. Bye.